This video is about social connectedness in the time of the COVID-19 pandemic, and in particular, how our social connectedness has been affected by COVID-19, as well as how it affects the COVID-19 pandemic in turn. We will be covering two main points today. The first one is how being together apart is possible, as well as how being together apart is crucial. Firstly, for an effective response. Secondly, to accurately model our health risk. And finally, for our psychological resilience in the time of crisis that we're all experiencing in 2020. First, I think it's worth pointing out that 2020 has been an unprecedented year. People like using that term when it comes to the COVID-19 pandemic, but it's been unprecedented in particular when it comes to the way in which we relate to one another socially. Whether it's Zoom birthday parties, whether it's the empty streets outside our homes and the evocative images we've all seen of what our cities have transformed into in the context of lockdown. It is the case that for many people, they have never been so isolated as they have been this year. And when I say isolated, I think it's important that we make a distinction between being physically isolated from one another, that is not seeing people face to face as we might usually do, and being felt and feeling isolated from one another. And that is that sense of loneliness we have when our social needs are not met. These two things are not the same thing. And just because we have been isolated from one another physically does not necessarily mean that people feel socially isolated. And in fact, that's a really important distinction to make, because when we talk about being together apart, what that really means is overcoming the physical isolation from one another, the physical distance, and still remaining socially connected in spite of physical distance. So is that possible? Well, indeed it is. And that's because at the heart of social connectedness, at least the social connectedness that matters when it comes to predicting important outcomes like our health and our capacity to organise an effective response, at its heart is actually a sense of felt belonging, or what we call social identity with a group. When we have that felt sense of affiliation with one another, a sense of community that emerges when we're in a meaningful group, that is when the magic happens. That's when we start to see these different outcomes when it comes to our willingness to work together and indeed our capacity to be resilient in the face of stress. This is because social connection is subjective, it's psychological, it's what emerges in a group environment when we feel like this group is not out there, this group is in here, and it's become part of how I see myself. So for this reason, when people become fixated on the frequency with which we see our social links, or indeed fixated with the modality with which we connect with one another, whether it's face-to-face or social media or Zoom or some other online mechanism that we've needed to all become proficient at this year, those are all distractions, really. It's not actually important whether we connect with people face-to-face or online, or indeed how frequently we connect with them. What's important is that we have that felt sense of emergent belonging and community that comes when we're in a meaningful social group. It's true that we have had to be innovative this year when it comes to ways to stay connected. But in fact, there are success stories from right around the world of people who have managed to do that effectively, whether it's singing together from balconies in lockdown cities, or cooperative online gaming, which has seen a resurgence this year and has bigger numbers than ever before. Whether it's online conferences or indeed online birthday parties, there are ways in which we can stay meaningfully connected to our loved ones, and it's important that we do so in terms of our capacity to stay together apart. So let's turn now to why that's so important. What happens when we are together apart that is undermined otherwise? Well, the first is that our capacity to effectively respond to the COVID-19 pandemic rests crucially on the solidarity that follows from that sense of social connectedness that comes in groups. So if we are not feeling like we are together, then we are much less likely to cooperate and coordinate. We're more likely to see this as an us versus them, zero-sum response where me staying healthy is more important than us staying healthy. So when we are together in a social group, we trust one another and we are willing to work together towards a shared goal, even if that shared goal requires some individual sacrifice. And so seeing this threat as something that we together, both as a nation or as human beings, can work together to respond to is something that enables us to work cooperatively to respond. And if we look at the statements in the countries that have had the most effective response, we see that their leaders have been very effectively using these collective statements in order to enable a collective response. The second reason why it's so important that we're able to be together apart is to do with our ability to accurately assess health risk. So particularly early in the pandemic, but even still, we see a lot of fear of catching COVID-19 from strangers. But in fact, most people don't catch it from strangers. They catch it from their loved ones. So COVID-19 is a disease that really exploits our closest social relationships, and our likelihood of really underestimating the risk that is posed by our closest social relationships. So this is a phenomenon that we see in social psychology more broadly. In fact, what we know is that our capacity to assess risk, not just in terms of our health risk, but also other risks like financial risk, is actually lower when it is in a social group that we strongly identify with. So this seems to be the case because we use our social group memberships as a heuristic for safety. So we're much more likely to perceive a particular scenario as low risk if the potential risk is coming from in-group members. And this seems to be because we trust fellow in-group members. We trust them to be honest with us about their contacts and their likelihood of having come into contact with COVID-19. We trust them to have good integrity and to wash their hands frequently and keep good social distance. And we trust them to be benevolent and to keep us safe, even in situations like with disease, where a person's desire to keep someone safe is not necessarily going to translate into a greater likelihood of them not being contagious. So there's lots of evidence that people do engage in more risk-taking when it comes to their loved ones, despite the fact that the risk is not lower there. In fact, if anything, it's higher because we tend to spend more time in close proximity with our loved ones. So we need to have a good understanding of our social relationships in order to more accurately assess health risk. And that means probably bumping up our level of health risk perception when it comes to our in-group members, and in fact reducing it when it comes to out-group members, that just because they are strangers to us does not mean that they are higher risk of disease. It also, I think, influences how our health promotion messaging should be approached when it comes to COVID-19, that instead of focusing on people being concerned about their amount of physical distance they have between themselves and strangers, instead we need to orient our messaging towards people's desire to keep their loved ones safe. We're all very motivated to reduce the likelihood that we pass on a contagious disease, a dangerous contagious disease, to our loved ones. And so if our messaging can focus on how we can keep the people that we care about safe, that's particularly likely to be effective. The final reason why it's so crucial that we're able to be together apart relates to our mental health. There is a very strong link that we've known about for decades between felt loneliness and poor well-being. The risk of depression, for instance, is increased by 24% for every social group membership that a person loses if they have a risk of depression in terms of a past history. We know that that relationship is very strong, that it's very robust, and that we see it both in vulnerable clinical samples as well as large population samples. As I say, this is all in a pre-COVID context, so we're all learning together when it comes to what the pandemic has done to our social connectedness and to the risk of mental health conditions associated with it. We do know from past pandemics that being in a lockdown situation, being in a quarantine situation, increases a person's risk of post-traumatic stress following the crisis. So it seems likely then that the COVID-19 pandemic will be a risk to mental health, both in the short term and the longer term, and also the degree to which we're able to sustain that sense of felt connectedness is likely to be protective for people's well-being. It's worth saying that that applies not only to our individual well-being, but also to public health, that is our whole population's sense of well-being. So this is high stakes for our communities. If we're able to be innovative in the way we connect to one another, then that is likely to have long-term health consequences.